Here with Dr. Tony Nimeh, urologist and men's health expert at Fairbanks Urology, and we're discussing Prostate Cancer Awareness Month. Dr. Nimeh, we hear a lot about the PSA Blood Test for testing for prostate cancer. Is this a reliable test?
Aaron, that's a very good question. Thanks for asking that question. I get that question all the time in clinic. And the PSA is a very important test in prostate cancer detection. And it is reliable for certain things, but it's also not reliable for other things. So what the PSA is a protein made inside the prostate, and that protein is supposed to be there. It's not abnormal. So it's like oil inside your engine. The oil is supposed to be there. But if you park your car in front of the house, and then in the morning you wake up and you go to the car and you find that the oil is all on the ground underneath the car, there's something wrong, and you need to figure out why is there a leak. Same thing with the prostate and the PSA. If the PSA is inside the prostate, if we do a blood test and we see that the PSA is elevated, that means there's a leak, and that leak is out of the prostate. So what's happening is the PSA is leaking out of the prostate into the bloodstream, and that's why we can measure an elevation in the PSA in the bloodstream. So what all of that means is that this PSA that we're testing in the bloodstream, we're testing to see if there's a leak in the prostate. Now, that being said, prostate cancer is not the only thing that can cause a leak, and there's a lot of other things that can cause a leak. That's why when you go see your doctor and he sees an elevation in the PSA, he says, well, I don't know if you have prostate cancer. We're going to have to investigate it some further, but let's do some testing to see if there is prostate cancer or not. So then the question in your mind is, well, what is the other thing that could be causing a prostate, cause the prostate to leak the PSA and for that PSA to go up in the blood? Well, there's a couple of different things. For example, any sexual activity before doing the blood test, that could cause an elevation PSA, because that is basically soliciting the prostate. And then also any manipulation of the prostate, like for example, if you had a procedure that involves the prostate, if you've had any urinary tract infections, that can also affect the prostate. If you had any physical activity like horseback riding or machining, or anything that puts a lot of pressure in the perineum, that will also perturb the prostate, and it may lead to a leak in PSA. That's why sometimes if someone had a prostate infection and then somebody measured the PSA, and we often tell, let's fix the infection, let's let it cool down and measure your PSA in 3 months. If it's still elevated, then we do have a reason for concern, and we have to investigate further.
So when should a man get a PSA?
That's an excellent question. The PSA is a screening test for prostate cancer that is done at the age of 50, and it's done yearly after 50 until we reach the age of 70. And the reason why we call it a screening test is because we are trying to find the cancer before it becomes symptomatic. The reason why is because if we find the cancer before it becomes symptomatic, then we have every chance of catching that cancer very early on. And if we do that, then the chance of a cure are very high. If we wait until it starts giving symptoms, what the symptoms are is that it starts basically perturbing or affecting the organs around, or it leaves the prostate and goes to the bone, and it starts creating fractures or breakage in the bone from the prostate cancer spreading to the bone. Then that means that the prostate cancer has become quite advanced, and then it becomes a lot more difficult to achieve a cure. We can still treat it, but we want to catch it before it becomes advanced, because then we maximize our chances of curing that cancer.
So then what happens if the prostate biopsy is positive?
Well, once we have a PSA that's elevated, we do a prostate biopsy, like you mentioned. And the prostate biopsy is done in the office. It's a painless procedure. It lasts about 10-15 minutes. And we send the specimen off to the pathologist. And the pathologist is a doctor that looks under the microscope at those tiny little biopsy cores that are basically prostate tissue. They're samples of the prostate. And he looks at every one of those samples and says, okay, well, there's nothing wrong, there's no cancer. Or he might say, there's a couple of places where I do see a cancer. In fact, the American Urological Association has classified prostate cancer in 4 different categories: very low risk, medium risk, and high risk. So those are the 4 categories, and depending on where the patient is, we will recommend different course of action.
We hear a lot about chemotherapy. Is this used in prostate cancer and treating it?
Chemotherapy is very rarely used in prostate cancer. It's very effective in other types of cancer, but in prostate cancer, the main ways of treating it is first surgery. Well, I should say the first is doing nothing. What we call active surveillance. So most prostate cancer in nowadays does not require any specific treatment other than keeping an eye on it. So if your doctor says we're going to keep an eye on it, it means it's called active surveillance. The reason why they call it active surveillance, it means that we are actively monitoring this cancer because we believe that if we keep an eye on it very closely, the second it becomes a cancer that is more aggressive or that is growing faster than we think it is, we have still a chance, an opportunity to completely cure it. And if we diagnose a low-grade cancer or a very low-risk cancer, and we keep an eye on it for, let's say, 5 years, and 5 years later we find out, hey, this cancer is starting to grow now. Hey, we have to be careful that this cancer might not spread, and we intervene at that point in time, then we still have a chance of curing this cancer. Now, what have we gained by waiting for 5 years? Well, we gained that for 5 years, that patient did not have to have a therapy and therefore did not have to suffer the side effects of the therapy, because unfortunately, every therapy that prostate cancer, that we use in prostate cancer will have some sort of side effect. There's always some sort of risk. There's always some sort of downside to that therapy. So by saying we're going to do just active surveillance, and 5 years later it took for that prostate cancer to grow and start becoming dangerous, then there was a 5-year period in that man's life where he didn't have to suffer any form of erectile dysfunction, he didn't have to suffer any form of incontinence, and he didn't have to deal with those side effects and that risk of the treatment that would have been. So let's say we fast forward, it's 5 years later, we do another test and we find that, hey, this cancer is now moderate risk or high risk, and we actually have to do something about it. Now, there's 2 main ways of treating prostate cancer.
What, in your opinion, is the best treatment for prostate cancer?
So that, again, depends on the type of cancer, and it also depends on the age of the patient. By and large, usually younger patients tend to be recommended to have surgery, and the older patients tend to go for radiation, mostly because the surgery has a higher risk when the patient is older, and mostly because if it's a younger patient and then they get a surgery done, then even if in the future they have a recurrence or that cancer doesn't completely go away, then there's always a second shot at treating it with additional radiation. And if a patient has to have both radiation and surgery, then it's easier to first do the surgery and then the radiation, rather than first do a radiation that may fail and then have to do surgery after that. Because doing surgery on a patient who had radiation is more difficult, because the tissues that are radiated, they tend to heal less well than tissues that have not been radiated. Now, earlier, I talked about radiation, and I want to say a few things about that. The radiation, there are new techniques to decrease the side effects of the radiation on the surrounding organs. The surrounding organs being the bladder and the rectum. And this is where the bowels end up before exiting the body. Is this rectum. This is the colon. The rectum is the piece of the part of the intestine that's just behind the prostate, and the prostate is right here and the rectum is right there, and the radiation is going to be focused on that prostate, and the rectum is at risk for receiving part of that radiation, and it's going to suffer some side effects. So now there's a new thing that we've been doing, and we've been putting a gel, which is sort of a spacer. In fact, this technique is called space-or, and the spacer is creating a space between the prostate and the rectum, because then the radiation that's going to the prostate has less chance of affecting the rectum. So this is an advanced technique that we're doing in Fairbanks that's going to allow the patients to have less side effects from the radiation.